So, hi everyone. Glad you can join us today on a Friday. So we're going to go ahead and start with our questions. The first one that we have for you is just like an introduction to yourself. We're at LA Mission College. We're in Silmar, California. This is a community college, and these are students who are interested in the field. So any type of help can help. Any advice and information that you give today will definitely be helpful. This is also being live streamed, and it's also being recorded for students who are not able to make it today, just so you know. So our first question is to tell us a bit about your educational background, both maybe in undergrad, graduate school, and your experience getting to the current place that you're at. And I guess we can start with Manson.
Okay, sorry. I just had to figure out how to unmute myself. Hi, everyone. My name is Vanson. Glad to see you guys are interested in OT. So my educational background is I did my undergraduate at UC Berkeley, and I majored in psychology and social welfare. At the time, I had no idea that I wanted to do OT. I barely knew what OT was. But for me, I knew that I wanted to work with people in some capacity on like a one-on-one, personal relationship kind of way. So I was thinking about psychology and also social work, but I kind of stumbled upon OT just kind of doing my own research into what other careers are out there. So it was similar and it seemed like something that fit my interest. So then I did some more of my prereqs. I got ready to try to apply to grad school. And I did my my master's in occupational therapy at University of Southern California, USC. So that's about it.
Thanks. And we'll have Leanne.
Hi, sorry about that. Had to also figure out how to unmute myself. My name is Leanne Gann. I am a CODA, or a Certified Occupational Therapy Assistant. I do also have a bachelor's degree from Cal State Northridge. Let's see. I have my associates from Santa Ana College, where they have their OTA program. Let's see. When I got my bachelor's in psychology, I actually started to get into preschool teaching. And I loved working with kids. And I kind of wanted to do more. A friend of mine was in the OTA program at Santa Ana, but at the time, I wasn't too familiar with OT, as many people always say. And I actually thought it was all adult. And when I found out that, it is also pediatrics, is when I got into that program. A lot of people do ask me, and I'm just going to say it now, if I have my bachelor's, why didn't I just go for my master's in OT? Part of the reason why was timing. I had gotten my bachelor's in 2004, and when I went into OT school, it was 2008, and I kind of just wanted to get started. I had all the prerequisites except for anatomy and physiology in order for me to start the OTA program, which I got, I applied in May and I got in August, where if I had to have gotten applied for my master's or for grad school, it would have taken me another year and a half. And now, I love being a CODA, and yeah, I'm currently at McCrory Pediatrics. It's a outpatient pediatric clinic in Tarzana, and I've been here since 2010.
Awesome, thank you.
Thank you.
Ina, are you there? Hi. Same question. Tell us a bit about your educational background, your undergraduate, and then how you got into OT and now in your program.
Hello?
Hi.
Hi, are you guys able to hear me okay?
You're on. We're doing the first question. Tell us about your background.
So I started my undergrad in Sacramento State. And then I just want to make sure you guys can hear me, right?
Yeah, you're good.
Okay, great. So I started my undergrad in Sacramento State. I was pre-med because with my family background, they wanted me to do nursing. I'm Filipino, and they told, and to kind of keep them off my back, I told them that I want to do pre-med, and then they stopped bothering me. But I was taking my prereq courses, and I felt like I thought it was going to take too long for me to become a doctor. I mean, I knew that I always wanted to help people, but I still felt lost. So I actually went to the career center and I took this test. And then one of the things that came up was social work, preschool teacher, kind of similar to you, Leanne, um, physical therapy and occupational therapy. And then I looked up physical therapy and occupational therapy, and I actually volunteered in like a physical therapy area. And I didn't like it, so I went for OT. So I went and switched majors, and then I did kinesiology for my undergrad, and I also minored in child development. And then after graduating, I studied or I applied to schools, and then right now I'm actually an occupational therapy student, and I'm going to West Coast University, and I'm on my very first level 2 field work, and I'm finishing up in August, and then I take the boards then.
Awesome, thank you. So the second question that we have for you is, in our workshop, we talked about the different areas or specialties in occupational therapy. What population or specialty are you interested or currently working in, and why? And then we'll start with Ina.
Okay. So starting with OT, I thought we were just all in the medical field, like acute hospital settings. That was my main like misconception stereotype because it's like the medical field. So of course that's where you would be working. But after going to school and learning about all the places we can go to, we can practically go anywhere. We can go to schools, we can go to community outreach, mental health, like it's bound, like the possibilities are endless. But right now for field work, I'm actually in acute care, so I'm at Cedars Hospital for my field work rotation. But I've been exposed to like little like grassroots organizations. I've had a 1 week field work at one grassroots organization in Los Angeles that opened up in their a homeless shelter for women, and that's very impactful. We have a role there to make sure, because with OT we want to make sure that everyone's they're able to do the things that they want and need to do in life. And sometimes with mental health, there's a discourse because they need help and assistance in doing that. So that's what I was exposed to. So yeah.
Cool, thanks. And where do you think you might want to go into after you graduate?
After graduating, I've been hearing a lot of good things in school-based occupational therapy. So I'm actually interested in hopefully shadow there. And I love medicine, so I think I'm really gonna try and stay in acute care and maybe do like a part-time job in like a pediatric facility or a skilled nursing facility.
Awesome, thank you. Leanne?
So I mentioned already that I'm working at a private pediatric clinic. Let's see. So because I was a preschool teacher before, and I was thinking that I wanted, and I was also working as a behavioral therapist, also in schools. I thought that I wanted to only do school based. When I graduated from school and I applied, there weren't any openings, and I was already currently working here at McCrory as a behavioral therapist, and there was an opening in the OT department right after I took my board exam. So I kind of seamlessly slid into the OT department here. And it has worked out for me because we do have an LAUSD funded program here in our clinic. So I am able to do some school-based OT in the morning. And then because we provide for multiple funding sources in the afternoon, I also get my regional center kiddos as well as my insurance funded kiddos. So talking about kind of the different areas of pediatrics that you can work in. I am doing my self-care for our kiddos. I am working on overall development with our regional center kiddos, as well as school-based for my kiddos that are in our LAUSD program. One of my field works, my level 2 field works, was in hand therapy. My fieldwork coordinator actually thought that it was going to be adult outpatient because that's what PT was there at that clinic, but it ended up that OT was all hands. But because, I was slated to start there, I said I'd give it a shot, and I actually really, really liked it. It's super technical. It's so functional. You learn so much in hand therapy that, I might be interested in doing something like that later too. So even if there's things that you think you may not be interested in, give it a shot because you may like it. And kind of going off of what Ina was saying earlier, is one of the great things about OT is that once you graduate, you are qualified to go into any population or setting. Is it helpful if you have extra education or certifications? Yes, absolutely. But, kind of depending on the facility and they're wanting to train and, what they want you to have experience in, you really the options are endless. I have a few OT friends that do school-based during the school year. And in the summer when the kids are on in summer school, they do adult rehab or hand clinic on the weekends. So it's nice that we have a lot of options for our field.
Cool. Vincent?
Okay. Yeah, for me, I don't think I mentioned earlier, but I am currently working in Northern California. I work at a skilled nursing facility. So the population that I work with is generally older adults. So these are people who have maybe gone to the hospital for whatever reason. They've been in and they've had an injury or illness, or they maybe have had like a scheduled surgery. For whatever reason, they're not ready to go home yet. They're ready to leave the hospital, but they're not ready to go home. So they come to us for short-term rehab until they're ready to go home. A lot of older adults, don't have that kind of support system, or maybe they, are just kind of on the edge of being able to live independently or living in like an assisted living facility. So that's a population that I currently work with. I didn't really know that that was going to be like my one specialty. That is what I'm doing right now. But in school, I was really open to working with a lot of different populations. And I think everyone else mentioned this already, but the great thing about OT is that you have that wide range of locations that you can work in. You can work in a pediatric setting. You could work in a mental health setting. Primarily, there are a lot of jobs in the medical setting, so like adult rehab and physical rehabilitation. But there are different options out there. I really like working with the adult population. Most patients are really great to work with. Sometimes it can be hard. It can be very challenging, especially in a skilled nursing facility, because you're dealing with some patients that just might not have the energy to really do things for themselves. So in an acute setting, you're really working on the basics of occupations. So really that's just like getting dressed, going to the bathroom, how are they going to get in and out of the shower when they go home? Even just like those basic self-care kind of things is what you generally work on a patient with. It can be physically demanding sometimes, depending on, how much help your patient needs. But it can also be very rewarding on the flip side to get them from a level where they need help with everything. They can't even like brush their teeth by themselves to get them to a point where they can go home. And that's when it really pays off. And that's one of the best things about my job, I think. I'm currently the director of rehab at our skilled nursing facility. So I also manage other therapists, occupational therapists, physical therapists, and speech therapists. They all work very closely together. If you ever consider that type of setting, you'll be working closely with a lot of nurses and other therapists as well.
Cool, thanks. So Brian, thanks for joining us. Well, I guess we can recap a little bit about your education, and then right now we're on the second question about your population. So maybe talk about your background, where you're at right now, and then what population you hope to work with after you graduate.
Okay. All right. So sorry, guys, about the technical difficulties. So I'll try to wrap up everything and summarize everything pretty concisely. So my name is Brian. I am currently a student. I'm almost done with my program at West Coast University. So right now I'm in my level 2 field work for the school. And so I'm at LAUSD, and I'm between 2 schools right now, but I'm mainly working with, the population of kids and peds, mainly with different disabilities like autism, intellectual disability, learning disabilities, among other plethora of disorders as well. Sorry, what else should I cover? Sorry about that.
No worries. We were talking about how your undergrad informed your decision to go into your program right now.
Perfect. Okay. Yeah. So I went to Cal State Northridge, and I studied psychology. And that just kind of led me into, and I had a lot of friends that are in the healthcare field, and studying psychology as my undergrad kind of helped with a lot of the courses that kind of led to occupational therapy. There's behavioral psychology, there's a prerequisite, developmental psychology, abnormal psychology. And so just kind of being in that undergrad field and then being exposed to like the healthcare field, it mended perfectly. And then I got into OT because I was curious enough about it that I followed through with, I shadowed an OT for a few hours to kind of see what the field's about and what the work was about. And I fell in love with the field right away. So I'm sure everyone has already spoken about, why they like the field and what brought them into it. So that's kind of my summarized story, I guess.
Cool. Thanks for catching up with us. Our next question is, how did you prepare for your career? What courses or research did you do in your
Sorry about that. They're making announcements at the school. So I'm actually at the school right now, just taking a little break with my CI. But what I did oh my God, this is a long announcement by the principal. So
if you want to yourself, and then we'll go.
Is there a way to turn that off?
Can you mute
Sorry, let me mute myself. Let me figure out how to do it. Found it. All right, sorry about
that. We'll start with Vincent with this question.
All right, cool. Let's see, for me, what did I do to prepare in like for school, or just like in general?
For the program.
For the program. Okay. So for me personally, I didn't know that I wanted to go into OT until I was like almost graduating my undergrad, and I was like, oh crap, like there's still classes and stuff that I need to take. So what I did was I just researched a lot of different programs. I knew at that point that I wanted to go and do an occupational therapy program. I just didn't know which one I wanted to do. So I just Googled, I researched what the different programs were, and looked at each of their requirements. Every school has slightly different requirements, although they're generally pretty the same. You have to take certain prereqs like anatomy, physiology, maybe like a medical terminology class, statistics, sociology, some similar classes like that. So I started by making a checklist to make sure that I had those classes. The classes that I hadn't taken yet, I tried to take them at community college. And then for me, also volunteering was, I think, a very important part in prepping myself for the program. Some programs will require a certain amount of hours for you. But I think in general, it's very helpful to get those volunteer hours just because you really see what you would actually be doing as an OT. Like, it's one thing to kind of read about it or look it up online, but to really get those volunteer hours in different facilities and different settings is going to, I thought, really beneficial for me. And what else? I studied for the GRE. Wasn't the most fun part, but everybody's got to do it. I think what I did was I just got a book for GRE prep and just kind of sat myself down, scheduled the time, and studied for the test, got it over with. And I built relationships in my volunteer work, for making letters of recommendation to. Some schools require letters of recommendation to. Let's see. And I think that's pretty much it for the requirements for getting ready for OT school. Mentally, I just kind of prepped myself to kind of see if I could see myself in the shoes of the people that I was volunteering. Like, could I do this for a living? Could I do this daily, over and over? And for me, that answer was yes. And, it wasn't like an absolute yes. I think I wasn't really sure at the beginning, but I think that's okay. I think a lot of people take time to figure out what works for them. And I think the great thing about OT is that it's so varied. You might not like one thing about OT, but you might really like another aspect of OT. So just like trying to see as much as you can before you start, I think, was the most helpful thing for me.
Awesome. We'll go with Ina next.
Okay. So like I said earlier, I was 50-50 with like physical therapy and occupational therapy when I found out that, that's one of the occupations that I should look into. So I actually volunteered in a physical therapy outpatient clinic, and it was nice. They were, doing their thing, helping people, building muscles, strengthening, and all that. And I love what they do, but it just wasn't for me. It wasn't as fun. It was very, I don't want to say mechanical, or, it was different. And then I observed at a outpatient occupational therapy clinic, and sometimes they're all in the same clinic. So I was able to see other people or other OTs in the outpatient clinic too. And their approach was just different. It was a lot more fun. It was occupation based. So it's things that people do already on a daily basis, like getting dressed, brushing their teeth, or building like a pottery plant, or for gardening. So it was a lot more fun. So that's why I chose OT. And then to prepare for it, I actually didn't take the GRE because I hated taking the SATs in high school. So I tried to go steer away from it. So when I looked up schools, that was one of the biggest things. I basically Googled I made this like huge Excel spreadsheet, listed all the schools that didn't have or didn't need GREs. And then that's how I filtered out and figured out which school to apply to and go to. And then if they needed prerequisites, then I would just take the classes that I needed. Some schools require like neuropsych, which is something different. And I feel like now OT and like PT, it's the new nursing because it's very competitive. So just like what Vanson was saying, really having volunteer hours and good connections with your supervisors and the OTs that you work with is important, because that can help push your application forward. And not just being in one facility. I remember trying to observe in multiple settings, because that also exposes you to a lot of things. Like if you go to a hospital, if you go to a skilled nursing, a school, an outpatient clinic, so then schools know that you've done your research, and it shows, and you spent time there to actually get to know the people, get to know the area, and it proves that you really do want to be in.
Awesome, thank you. And then next we'll have Brian.
Okay, I think I'm finally on board with this. So I think everything that Vanson and Ina had covered as far as getting ready for OT school is super useful. I think my one advice that I would give, like what I did personally was, because I didn't even know about OT when I finished my undergrad. So as I did research, if you have the time and if you're able to kind of make a spreadsheet among like the schools that do offer OT programs and look at what they require to get into their school. Because like they said, some schools require different classes because, like, for example, San Jose State, they require like a 3D art class. Like they make you take like a sculpture class or something that most other schools don't actually require. So just looking at what they require and then getting ahead to like contact certain facilities nearby that could offer hours for you to observe, because the one place that I got most of my hours at, they didn't even get back to me until maybe like 9 months later. So just being proactive right now, looking at what you can take. If you're taking your undergrad right now, looking to see like anatomy, physiology, and other classes that are prerequisites, see if you can take those now. And there's another announcement. I'm going to mute myself. Sorry about that.
Awesome. We'll hold on that, and then we'll go with Leanne and talk about your experience, because your experience was a little bit different going through OT school.
Right. So as a CODA, different, and this was also about 10 years ago, so the requirements were a lot different. Like I said, I didn't really know that I wanted to go to OT until, say, May in 2008. I applied and I was accepted right away, and I actually started in my program August of the same year. But I kind of did the same thing. Like I said, having a bachelor's, I really had to weigh the pros and cons on if I wanted to do the OTA program or if I wanted to do the master's program. Obviously, the OTA program had more pros at the time. If any of the prospective students also wanted to know about the difference between a CODA and an OT, you can also ask me those questions at any time. But I would say to prepare for OT school in general, kind of what everybody else is saying. Like I said, when I had to apply, I didn't need observation hours. Right now, it is a big, big, big deal to have those hours. Right now, here at our clinic, I actually coordinate our student observers. I have a thick pile of people to call back wanting observation hours. And requirements, because I've been doing this for a few years now, coordinating these student observers and getting their hours. Schools, like everybody said, schools requirements are all different, and they're changing from what I've seen every year. It used to be certain schools, it was a minimum of 30 hours, and then now it's a minimum of 80 hours, and then it's a minimum of 100 hours. Some schools now want 30 hours in one setting and 50 hours in another setting. So, just really keep on top of what your school's requirements are, and really trying to find different settings and populations to observe. Preparing for OT overall, I think somebody mentioned, there are certain settings where you really have to push yourself, because in school, they cover everything. So if you think that you want pediatrics and you think that you aren't really wanting to work with adult or geriatrics, to a certain degree, you may have to, and you may have to do it well in order to get through your coursework, or your field works. So, just know that you're going to be really challenging yourself. Or if you want to work in pediatrics, know that a lot of what we do is working with caregivers and families. And for a lot of therapists, that's what's more challenging. Let's see. I also did not have to take the GRE because it was not required for my program. So if you're trying to get around that, then OTA may be the field for you. And also, like I said, for preparing for or to be accepted into school, having my bachelor's and certain classes that I had under that degree definitely made it a little bit easier for me to get into my OTA program.
Awesome, great advice. So I guess in the interest of time, we'll skip over a few, but what does an OT program look like? How many classes are you taking? When, how soon or how early are you able to work with patients? What does that look like for you? So we'll go ahead and go with Leanne again.
So I'm not 100% sure if Santa Ana College still offers this, but my OTA program, my lectures were actually online. And I went down to school for my labs 2 to 3 times a week in the semester. They say that they kind of cater towards more maybe older applicants that maybe need to work during the day. So I did work as a behavioral therapist in the day. I did my online lectures at night. My work was here in San Fernando Valley in Northridge, and my classes were at Santa Ana College. So I did have to take that 1.5 to 2 hour drive 3 times a week for my labs, and then drive all the way home after. So definitely the day-to-day schedule was pretty grueling. But I loved what I was doing, and I loved what I was studying. And it all pays off in the end.
Cool. Brian, what does the program look like for you in terms of classes and your responsibilities?
So specifically with West Coast University, and I'm sure Ina can chime in on this, it's a full-time program. We're there 4 days a week from hours usually ranging from like 8 to 4 or 9 to 5. And it's pretty as intensive as they warned me it was going to be. It's if you're not reading or catching up, then you're getting ahead for a paper that's due that Friday, and you got to work on that to make sure that you're ready for the project on Monday. So it's very, at least in my experience so far with West Coast, has been very intense. I know another college I was looking at, which recently got accredited, was Stanbridge, and I think if it's still the same, they have a program, like their program is catered to people who still have jobs. So I think their program might be a little longer. I think it was advertised as a part-time program, but I remember like there, and like Leanne had mentioned, there's programs that are catered to you, like if you still need to work, if you have a family, and you're not able to dedicate 4 to 5 days a week towards a program, you could like Stanbridge, I think it was like 2 days a week that you go to, but from West Coast's point of view and their curriculum, it was pretty intense. So I worked for a little bit, and then after a trimester of working and going to school, I realized one had to go. So I quit the job and then dedicated the rest of my time to school. So you got to dedicate a lot of time to it.
Awesome, thanks. Ina, do you have anything to add to that?
Yeah. So like just to give more examples, at one point we kind of had like 6 or 7 classes in a trimester, and that was very new to me. But it's definitely great to look into the school's like cohort or class size, because I think ours is a little bit unique because our cohort, there was only 28 of us. I think now they increased it to 34, but having like a small group, it's really helpful, because when we started, I was scared because I didn't know that it was an accelerated master's program. I thought that it was really going to be super competitive, that everyone's there to get, just the best grades ever and try to one up each other. But it actually wasn't. When we started, we told everyone that we're all in this together. We're going to do this. We're going to help each other out. And now we're family. I've gained like new brothers and sisters, and we help each other out with the projects, because it gets crazy. And trying to remember what projects are due when and how they want it done, you can't do it alone. So having a good cohort, so looking into the classes and the schools and how the students feel about it is good too. But yeah, it's hard, but it's doable.
Awesome. And Vincent, how was your experience at USC like with maybe some of the classes that you took there?
Yeah, so I can speak a little bit about USC. They might have changed their curriculum a little bit because it's been like about 4 years since I graduated. It is a full-time program, so pretty intensive, Monday through Friday. You're doing something most of the day. For like how much hands-on experience you get with like actual patients and being at the places, you start pretty early, like in the first semester. The USC does a semester system with like your first level one field work. So one day out of the five, you're doing your field work, and then the other 4 days you're taking classes. Um, USC breaks it up into you have like there's three different cohorts, and you rotate in the different specialties. So I started with physical disabilities for my first semester, and then I took about like 4 or 5 classes related mostly to physical disabilities. And then the next semester it was mental health, about 4 classes. And then the last semester was pediatrics. And then the final semester was just electives that you can take to kind of move you towards a special area that you want to get into. But it was overall a good experience. I kind of agree with Ina about how you really get to bond with the people in your cohort. I think that was the most fun thing about OT school for me, was just that, it's not really competitive, at least from my experience. Everyone's trying to, all get to the same place, and we're not like fighting for a certain position or something. We all want to be occupational therapists, and to have people that kind of share your interest or share that passion with you is really great to have. It can be hard at times. I remember just like a lot of reading, a lot of studying, but in the end, it was a lot of fun just in general. Yeah.
Like, we have two last questions. One is, or the next one I guess is, what does a typical day at work or at your current field work look like? And then we'll start with Ina.
Okay, so I am in an acute hospital. Again, like I said, it's Cedars-Sinai in LA. And even with the hospital setting, you can get placed in different areas because, some people get hips and knee surgery. Some people get, spinal cord injury, a stroke, and things like that. In my floor specifically, we deal with orthopedic conditions. So that's when they have like fractures or hip replacements, joint replacements. On a typical day, Cedars is nice because it's a nonprofit hospital, so they don't care so much about productivity. And this is basically how many people you see in a day. And that's a big thing with insurance and this whole hullabaloo. But with Cedars, so it's not as stressful because you don't have to meet a lot of people in the same day. But in a typical day, we try to see maybe 6 or 7 patients, and we spend in a hospital, all you usually do is evaluate them to see how safe they are at home. And with occupational therapy, it's things they do throughout their day. So I've been doing evaluations, and I would assess how they do little things like put on their socks, put on underwear, brush their teeth, go in and out of the bathroom, making sure if they need any equipment at home. Because sometimes with hips, there's some things after surgery that you're not supposed to do. So then there's equipments that can help you, like a 3-in-1 commode or a reacher or a long-handled sponge brush and things like that. And it's a lot of education because if you're in school, you're exposed to a lot of things and all the equipments, but really explaining it to them and them hearing about it, it's pretty cool because it's like you've given them this like magic answer to what they're having problems with. So that's pretty cool. But yeah, it's very fast paced, and you have to know your stuff, and you're dealing with a bunch of lines like IV, wound vacs, and that's like if you have other issues. Some people have fractures, so they can look very intimidating, but you just have to work with what you have, and yeah, manage your time wisely. But yeah, it's fun and exciting.
Brian?
Okay. All right. So typical day for me here. So I start at 7:30 in the morning. Usually have time in the morning to come up with interventions like these ones behind me that I work with and the kids. I usually see kids in groups of, as small as 2 and then up to groups of 3 or 4, depending on, the schedule size and when we can fit it in. Certain days are a little crazier than others. Like this past Wednesday, my CI and I had 3 IEPs to attend to, which can take anywhere from like an hour to an hour and a half, where we have like meetings with the speech therapists and with their teachers and the resource teachers, and we just discuss their progress and goals for the next year. And then we also had to still see our kids. So that was like a pretty busy day. But typically, like, I'll just see groups throughout the day up until about 4:30 after we do all our notations and everything, and then we are free to go, pretty much.
Nice. Leanne?
So my workday starts at 8. If we, as an outpatient pediatric clinic, so we get scheduled on the hour for kiddos. So if I have a kiddo that, comes in and they need an 8 o'clock opening, then I may have an 8 o'clock client. If not, then I have consult for my school-based kiddos. From 9 to about 12:30 is when I'm in my LAUSD program here in the clinic. Between 9 to 11, I do 20-minute rotations with each of my kiddos. From 11:20 to 12:20, I run 3 different 20-minute groups. Group size can vary anywhere from 2 to 5. I have a little admin time, then lunch, and then at 2, 3, and 4 o'clock, I may have back-to-back 60-minute individual sessions. Our schedule can really vary. It just kind of depends on how many kiddos we have at one time, scheduling and availability of the families and myself. Right now I maybe have like an hour or 2 of admin a day, which is nice. Sometimes in a pediatric setting like this, you can be back to back the whole 8 hours, similar to a lot of other settings. But right now I have about an hour a day, which is really, really nice. At that time, even as a CODA, I am fairly independent in writing reports and establishing goals. I do have them signed off by my supervising OTR, who I've treatment planned and gone over everything with. So admin time can definitely take some time in pediatrics. Writing the kids' goals, depending on the funding source of how extensive it needs to be. Lots of family meetings. Kind of what Brian was saying is that since I'm in an LAUSD program, my kiddos do have IEP meetings. I don't have to attend the formal school IEP meeting, but we do hold IEP meetings with each family before they have that formal meeting. So we review, same thing, progress towards goals, suggested goals, strengths, weaknesses, and prepare that family for that IEP.
Cool. And Vincent.
Okay, so a typical day at a skilled nursing facility. Skilled nursing is pretty notorious for, the level of productivity that you're expected to have. Our building is pretty good with it, so we see about, and what I mean by productivity for you guys is just the amount of patient care that you're doing as part of your day. So it's expected that you should be seeing, like, if you have an 8-hour day, like 7 of those hours would be with patient care directly. So on average, you see about 7 patients. Sometimes it could be more at different skilled nursing facilities. Sometimes it could be less, like maybe like 6 or something. But you're seeing probably at least 6 or 7 patients a day. You kind of start with your schedule of patients. And these are probably people that you have been working with for a while. So patients are staying there overnight, so you're continuing to follow this patient like on a weekly basis. And sometimes you might get new patients where you're evaluating them and assessing what they can do what kind of goals are appropriate for this person, what's realistic goals for them. And you're discussing this with maybe the patient, with maybe family members, of what you're trying to accomplish in the next couple of weeks. And you develop a treatment plan. So that's what you do day to day. You work on the specific goals that you're doing, and goals are very functional. So specifically, I'm going to work on toileting for Mr. Smith, or I'm going to work on lower body dressing for Miss Jones. And that could be in various different ways. It could be education, where you are teaching a specific skill or a specific adaptive equipment, teaching the patient how to use this. It could be more physical based, where you're trying to strengthen a certain part of the body or work on coordination. It could just be like general practice, like, okay, let's practice going to the bathroom. Like, how are you going to do this? And if you're going to work in skilled nursing, you can't be afraid to get close to the patient. You can't be afraid of like bodily fluids and stuff like that. That's kind of going to be your day to day, is working really closely with people to get them up out of bed, or get them dressed, get them changed and stuff like that. And it's nice though, because each day you're supposed to be helping the patient get better at it. So they can be doing more and more as they go on. We do spend a good amount of time documenting. So everything that you do, you pretty much have to write a description of what you did and how you did it. That's an important part of the medical field, is just documentation. It's not the most fun thing, but it is like kind of a necessary evil, essentially. It's not the favorite part of your day, but it is important in terms of like billing and reimbursements, and just making sure that the patients are getting good care. So it can be pretty busy. You have to kind of think on your feet sometimes and be flexible. I think it's a little different from outpatient in that sense, because in outpatient you have a person scheduled from like 11 to 12 or 12 to 1, and you can do that with your patients in skilled nursing, but things always kind of come up. Like there might be an appointment that the patient has to go to, or the patient's not feeling well at that time and they want you to come back. They are there the whole day, so they might not want to see you at that particular time. So you kind of have to think on your feet a little bit. And that's pretty much, I think, the essence of working in skilled nursing.
Cool. So now we're going to open it up. I don't know if anyone has any questions for our participants.
I had a question in regards to choosing West Coast University. Was it because the lack of the GRE that was needed, or why West Coast University other than any other schools here in California?
Anyone can take it.
All right, so you kind of hit the nail on the head. So kind of like Ina, when I was looking at schools, one of the main things was I didn't want to, like, if I didn't have to take the GRE and pay that gross amount of taking the GRE, then I'd be happy not to. And so before I started to apply to other schools, I made sure that I tried I tried applying for West Coast, and it's pretty local. Like I'm still pretty close to my family, so I didn't want to go like too far away from them. So it kind of worked out for me. You have anything you want to throw in there?
University here in Hollywood. I'm
Sorry, go ahead.
Is it the West Coast University here in North Hollywood, or what West Coast University do you attend?
No, this is the one, because they have a CGS, Center for Graduate Studies campus, and it's in, I think, Koreatown. Is that fair to say?
Yeah, right next to Koreatown.
Yeah. So I'm actually from Sacramento, and I applied to a lot of schools in, NorCal, SoCal, even out of state. But really what drew me in West Coast is the small class size. And aside from the GRE, because that was, easy, I didn't have to take it. It was really the small class size. And coming from a big state school, I think that I wanted the change. And it was really different. It was, you're all in this one building and it was a change, but I liked it. It was smaller, more intimate. I got to know the professors really well. They're on the same floor as us. They have an open door policy, and yeah, that's why I chose it. And I also looked at like Touro University in Nevada and other places like that.
And then kind of to add on what Ina said too, I remember just one more thing too. When I was looking into the school, I looked at the professors that were there and like the people that taught there and who ran the university, and they were all they're pretty established in their own in the field. So it was the big plus for me too looking into the school. I didn't exit out, so I was happy about that.
Thank you.
Any other questions? So I guess the last question that we have is any advice for our students who are interested in starting the field now that they're starting to take prerequisite courses, hopefully transferring in the near future. What advice do you have for someone going into the field of OT? Go for it, anyone.
I'll say something really quick. So kind of like what I was saying, be proactive about it right now. I think you're at an advantage that you know about OT if you're doing your undergrad right now. So look into the prerequisites that you need to take so that, because when I graduated, there was a 2-year lag between when I got my bachelor's and then when I started the master's program, because I had to retake a bunch of classes. A bunch of my classes that I did take were expiring, like depending on what school you want to apply to. So definitely a plus if you can look into what classes you can take right now, take it. See if there's places nearby where you can get your observation hours, even if you're just curious about the field, and hopefully that'll like solidify your desire to pursue this field. So just jump on it, and I promise you too, the more you get into the field, and the more that you take the classes and get invested in the field, the more you'll fall in love with it, because it's an awesome field.
I think that I would also really recommend that you start your observation hours sooner than later. I think somebody mentioned that it's kind of common. Like I said, I have a stack of people wanting to come in for hours, and I literally just haven't had a chance to contact everybody. So, you are going to hit a couple dead ends. I might even say a lot of dead ends, trying to find facilities that will take you, because the OTs that you're wanting to shadow, they're going to be taking you on top of their current caseload. I had one applicant that one OT straight up said, "I don't have time," and I that probably is going to happen a lot. And I've found a lot of applicants that tell me that don't just do the minimum. I've had applicants tell me that they had some students or some, because I think school is just getting more and more competitive. They've had some students that had hundreds of hours, and maybe it was in one field or one setting, one population, and the school wasn't having it. And I can only imagine that it's just going to keep getting more competitive. So even if you're not sure, even if you think that this isn't really the population that you want, just try and get as much experience in the field as you can. I actually even have some high school students that are already contacting me. I have some freshmen, sophomore in their undergrad wanting to start now to get their observation hours. And on top of that, if I currently have 4 or 5 student observers, I let them know that I cannot start you until the fall. And if you're wanting to apply in the fall, I'm sorry, I'm trying to get you hours, but if I can't do it until, 5-6 months, that's what I'm going to tell you. And I've had some applicants tell me that I am more flexible than other OTs that they've talked to about trying to get hours in. So even if I know that it's hard for me to get you scheduled, I can just imagine kind of the feedback that or reception that you're getting from other OTs.
Okay. I just my advice for anybody who is feeling like a little discouraged or overwhelmed, don't worry, because I know how you feel. Because when I applied, I was like, oh my gosh, I have to do all this. I have to get a GRE. I have to do volunteer hours. Places are not going to call me back. I have to do all these classes that I haven't taken. I'm already done with my bachelor's. How am I going to get all this done? But I think the same way with any big task is how do you eat an elephant? You do it one bite at a time. So just kind of organize yourself, try to figure out, what you need to do as best you can. Like I think Brian mentioned, like making like a spreadsheet of like the different programs you want to apply to, what the requirements are, and just like starting to chip away at each thing that you need. The volunteer hours is a good thing to get started with as early as you can, because it takes a long time for some places to get back to you. But once you get it, once you're in a place, it's pretty smooth just to kind of see like what they actually do there. So it's a really good experience too. And just like keeping an open mind to different things too, I think was really helpful for me. Because at first I thought I didn't really want to do any pediatrics. I'm not working in pediatrics now, but as I'm working in the field, it's becoming more of a possibility. Like, oh yeah, I could see myself in pediatrics too. So keeping an open mind is a great thing for OT, because there's just so many different settings that you can work in.
Cool, thanks. And last but not least,
you guys pretty much covered everything. But I just want to add, make sure you have fun while you're doing it. And it might get frustrating because you think there's so many things that you have to do and all the hurdles that you have to face, but it is going to be worth it. Just, take it one day at a time. And next thing you know, you're going to be graduating OT school, passing the boards, and like becoming OTs in the field that you want to be in. Yeah.
It's worth it.
Yes. Good luck.
It's worth it. I don't think I've ever met an OT that said they didn't love what they do.
Yeah.
Awesome. Thank you so much for spending your Friday afternoon with us. We are going to share this information with the rest of the campus. I'm sure a lot of students would benefit from this. If it's okay with you, is it okay if our participants that came in today have contact information from you and maybe do follow-up questions with you?
Yeah, totally.
Yep.
Sure.
Thank you.
Have a great weekend, and we'll see you.